A ganglionic cyst is the most common benign cystic tumor that we see in the body, and it most commonly affects the hand and wrist. This is probably the most common complaint I tend to see in the office of a patient who says, I have a bump on my hand or wrist. The etiology of this is idiopathic, occasionally could be associated with arthritis, especially over the small joints of the fingers. Most commonly, the patients will complain of a painless swelling that's associated on the top or palmar aspect of their hand and wrist. Occasionally, this can get a little bigger with activity and at times could become smaller with rest. Occasionally, when the cyst is large, it will be somewhat painful, usually associated with activity. The diagnosis is confirmed by history and physical exam, and further confirmed by an aspiration, which usually reveals a clear, jelly-like fluid from the aspiration. The vast majority of these are treated non-operatively. The vast majority of these will disappear on their own over a period of 1 to 2 years. For the conservative treatment, we initially, depending on how much it's bothering the patient, just observation and reassurance. If it is somewhat painful or cosmetically unappealing to the patient, I would recommend up to 3 aspirations, usually 2 to 3 months apart. If that fails, to control the cyst and the patient is still unhappy with the appearance and or pain, then surgical intervention is then warranted, but this is rare in my practice.